Hello, my name is Fernando. This video will demonstrate the proper procedure for the assessment of resting blood pressure. Patients should be seated quietly for at least 5 minutes with proper back support, feet flat on the floor, and their arms supported at heart level. It is important to note that the patient should refrain from caffeine and nicotine 30 minutes prior to assessment. Measurements should be taken on your bare arm. Locate the patient's pulse at the brachial artery. The appropriate cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. Align the cuff with the brachial artery. Make sure the cuff is wrapped firmly around the upper arm at heart level. When using the stethoscope, make sure that the prongs are facing forward. To ensure the stethoscope is working, twist the top and lightly tap the diaphragm until you can hear clearly. Place the chest piece below the antecubital space over the brachial artery. With the valve tightened and the bulb in your hand, pump the bulb to inflate the cuff. If working with the new patient, inflate the cuff to 180 to 200 millimeters of mercury. If not, inflate to 20 millimeters of mercury above the first carot cough sound. Slowly release pressure at a rate of 2 to 5 millimeters of mercury per second. While releasing the pressure, you will be listening to a sound similar to that of a heartbeat, known as the carot cough sounds. The first carot cough sound will indicate systolic blood pressure. The final carot cough sound will indicate diastolic blood pressure. It is important to become familiar with the classification of blood pressure. Normal blood pressure shows values of systolic blood pressure less than 120 and diastolic blood pressure less than 80. Prehypertension shows values of systolic blood pressure between 120 and 139 or diastolic blood pressure between 80 and 89. Stage 1 hypertension shows values of systolic blood pressure between 140 and 159 or diastolic blood pressure between 90 and 99. Finally, stage 2 hypertension shows values of systolic blood pressure greater than or equal to 160 or diastolic blood pressure greater than or equal to 100. Thank you for watching.